Hi, my name is Melinda Coghill. I'm going to walk you through today an introduction to Medicare. So, our goals for today, we're going to give you a basic understanding of Medicare, understanding the differences between Part A and Part B, or the difference between using a Medicare Advantage plan versus original Medicare with a supplement. We're also going to teach you the 6 steps of Medicare to help you understand why taking each step in order is critical to avoiding costly and potentially permanent Medicare mistakes. And we're also going to provide you with a unique opportunity to get your own customized Medicare RoadMap. And of course, a RoadMap is a report detailing the steps that you should take to enroll in Medicare, as well as specific information to your unique Medicare situation. So let's get started by learning a bit more about what I would like to call the Medicare situation. All right, so each year in the United States, we have 3.6 million people turning 65 and becoming eligible for Medicare. 3.6 million people, that's a lot of people. If you actually take a look at the numbers, this is a population greater than 27 different states in our country. That's a lot of people. Unfortunately, when it comes to Medicare, more than half of these people are willing to admit that they don't understand Medicare at all. So, as they go along in the Medicare enrollment process, it's very likely they're going to encounter some sort of Medicare enrollment mistakes. Unfortunately, they're quite easy to make, and sadly, though, just one of these mistakes can often cost a person literally thousands of dollars a year for the rest of their lives, and sadly can even keep you from getting needed healthcare services. But why is this happening? Well, as you may have already noticed, we are forcing people to become Medicare experts simply to enroll in the program. In fact, when you are about to turn 65, you're going to automatically receive a booklet in the mail from Medicare explaining the Medicare enrollment process. This booklet is called Medicare and You. The 2019 version of this booklet is 120 pages in length, and it isn't even comprehensive. So, heaven forbid you decide you can't do this on your own, or you don't want to do this on your own. If that's the case, where do you turn for help? That's probably the biggest problem with Medicare today. Luckily, you're here. Pat yourselves on the back. Yay! Today, we are going to ensure that you get the Medicare enrollment guidance you need that is fast, simple, expert, and unbiased. With this information, you're going to be able to make the best Medicare decisions for your unique needs and avoid costly Medicare mistakes. So let's get started by learning some Medicare basics. So, you've probably heard that Medicare has 4 parts: A, B, C, and D. However, we actually prefer not to teach it this way because in our experience, people have the tendency to treat this like a shopping list. I have to get an A, a B, a C, and a D. No, quite frankly, that's not true because C is simply a repackaging of A, B, and D. So instead, we prefer to teach that Medicare has 3 parts: A, hospitalization, B, medical insurance, and D for drugs, and 2 distinct paths, 2 unique ways to get those 3 parts of Medicare. So let's take a look first at the parts of Medicare. First, we'll look at Part A. Part A is hospital insurance. This is the part of Medicare that is premium free for those who have paid Medicare taxes for 10 years, or for those who have a spouse that has paid for those 10 years. If you are ever hospitalized or in need of skilled nursing facilities or hospice services, this is the part of Medicare that will provide you with this coverage. And unfortunately, we are really not speaking here about assisted living facilities. So activities of daily living are not typically covered by Medicare. All right, onward. Now, there's also Medicare Part B. This is medical insurance, the part of Medicare that you will need to diagnose and treat medical conditions. This part of Medicare is considered optional, but if you do not enroll in this coverage, you may face late enrollment penalties later on. Part D. This is prescription drug coverage. It is coverage provided and administered by private insurance companies, not the U.S. government. This coverage helps to cover the cost of prescription medications in a plan's formulary. A drug formulary is essentially a catalog of medications that a plan will cover and how it covers them. It's important to note that a Part D plan helps to cover the cost of medications. In many cases, you will share in the cost of your prescription drugs through deductibles, co-pays, or co-insurances. It's also important to note that Part D plans do not cover over-the-counter medications, vitamins, other supplements. Now that we've discussed the basic parts of Medicare, let's talk about the two distinct paths or types of Medicare coverage. Most people, when they turn 65, have two path options available to them: Original Medicare or Medicare Advantage. Some people have extra path types, such as retiree coverage or military coverage options, but for today's session, we'll address the two main paths that most people face when they're about to turn 65. First, let's talk about the path of Original Medicare. This is Medicare administered by the U.S. government. That's why we've put a Capitol building in the background. When you choose this path, technically the U.S. government is in charge. You can see any provider who accepts Medicare, regardless of their location. Essentially, there are no networks. This means you can see providers while on vacation in sunny California or skiing the slopes of Colorado and receive the same coverage you would receive when you're at home. This path always starts with a person enrolling in Part A and Part B. Technically, you could stop right here and say, I'm enrolled in Medicare. Yes, technically that is true, but that can be a very expensive way to do Medicare. In fact, Part A has a $1,400 hospitalization deductible. Notice I said hospitalization deductible and not an annual deductible. You will essentially pay this every time you are hospitalized. And Part B has a 20% coinsurance on all healthcare services. 20% of every doctor's bill, every specialist's bill is your responsibility. And A and B by themselves have no out-of-pocket spending limit. So you could literally spend and spend and spend until you have nothing left. This is why for comprehensive coverage, you also add a Medigap policy provided by a private insurance company and a standalone Part D prescription drug plan. Once you put these two extra pieces in place, most, if sometimes not all, of the out-of-pocket costs inherent in A and B by itself can poof, go away. Now, let's talk a little bit more about what a Medigap policy is. Medigap policies are the same thing as Medicare supplements. It is coverage provided by a private insurance company. These policies cover those things that Medicare Part A and B typically do not cover, such as the $1,400 hospitalization deductible or the 20% coinsurance for healthcare services. With this coverage, you essentially pay one monthly premium, but then have few, if any, out-of-pocket costs when you use healthcare services. With a Medigap policy, you essentially never need to worry about Medicare Part A and B not having an out-of-pocket spending limit because you essentially do not have out-of-pocket costs with this coverage in place. Medigap policies have been standardized by the federal government into 10 plans, known by letters such as Plan C or Plan F. Regardless of the insurance provider or the premium you pay for this coverage, each plan must provide the same benefits. So, for example, the Plan C you get from Mutual of Omaha will cover the exact same things from the Plan C you get from Humana. Finally, in order to get a Medigap policy with no medical questions asked, you must have a guaranteed issue right. Okay, so what is a guaranteed issue right? Well, essentially, this is a rule that ensures that you can get a Medigap policy with no medical questions asked. When you have a guaranteed issue right, insurance companies cannot deny you a policy or raise premiums based upon your medical history. You have a guaranteed issue right to get a Medigap policy for the first 6 months that you are 65 years or older and enrolled in Medicare Part B for the first time. Once both of these things are true, essentially a clock starts ticking until the expiration of your guaranteed issue right. After you lose your guaranteed issue right, insurance companies can put you through underwriting, ask you medical questions. If they find anything they do not like, they can deny you coverage, and you may not be able to get this coverage again in your lifetime. Now, there are some important states to note: New York, Connecticut, Massachusetts, and Maine. These 4 states give you the unique ability to still get a Medigap policy with no questions asked outside of the standard guaranteed issue right. Now let's take a closer look at the costs associated with the path of Original Medicare. Part A is premium free for those who have paid 40 quarters of Medicare taxes. Everyone enrolled in Part B, regardless of path, pays the Part B premium. Those enrolling in Medicare in 2019 will pay $135.50 per month. The price of a Medigap policy varies by company, zip code, age, type of plan, etc. A standalone Part D drug plan begins at about $15 per month and goes up from there. So thus, we've calculated the Medigap policy and Part D drug plan premiums to total $115 a month to over $400, which is untypical but is possible. Now let's talk about the other path of Medicare, known as Medicare Advantage. The first thing you'll notice is that there is no Capitol building in the background. Instead, we've put a corporate building. The reason why is that when you choose this path, this is Medicare administered by a private insurance company. On this path, the insurance company is in charge. They get to make the rules. And when you visit the doctor, you'll pull out an insurance card, not your Medicare card. Now, Medicare Advantage policies have to provide basic Part A and Part B services, but they change the rules that you have to follow in order to get these services, and we'll talk about the rules in just a second. Plans on this path usually roll in Part D drug coverage as well. Then, to make these plans and this path as attractive as possible, these plans usually have very low or no monthly premiums. This is a huge selling point for Medicare Advantage plans. And they can add in extra benefits that typically Original Medicare does not include: vision, hearing, dental, sometimes long-term care or safety handlebars, things like that. Now, the insurance company is going to basically take all 7 of these elements and mix them into a new package of Medicare known as an MAPD plan, Medicare Advantage with Part D drug coverage. This is what Medicare refers to as Part C, but as you can see, it is really much more of a path than a part. Remember, on the path of Medicare Advantage, you have to follow the rules of the insurance company. Here are some of the most basic rules. You have to see providers in a network. Legally, that network can change at any time, and if you go outside of the network, you may be completely on your own paying that bill. You are subject to prior authorization rules when you are on this path, meaning your doctor says, hey, you need surgery and then physical therapy. But before you can use surgery and physical therapy services, you have to get the insurance company to agree with your doctor and agree to be willing to pay for those services. And of course, every time you use healthcare services, you are responsible for paying any deductibles, co-pays, and co-insurances up to that plan's annual out-of-pocket spending limit. Now let's take a look at the costs on the path of Medicare Advantage. Once again, if you or your spouse has paid 40 quarters or 10 years of Medicare taxes, you'll receive Part A for free. And yes, you still do pay for Medicare Part B on the path of Medicare Advantage. Now, here's why your initial enrollment into Medicare is so vitally important. In 46 states, as soon as you make your path decision, you basically have to imagine that an earthquake happens behind you. Now, if you want to change paths, types of coverage, you're going to have to wait for a bridge. But bridges only show up at certain times of the year, and in order to cross, you have to follow the rules of the bridge. It's actually pretty simple to switch from original Medicare to Medicare Advantage. As long as you're doing it at the correct time of year, Medicare Advantage plans have to take you regardless of any pre-existing medical conditions. Here comes the problem. The problem is when people want to switch from Medicare Advantage to the path of original Medicare. They often think that they can get everything that's over there. But chances are you no longer have a guaranteed issue right to get a Medigap plan. And if you do not have that guaranteed issue right any longer, the insurance company can ask you medical questions. If they find anything they do not like, they can deny you that type of coverage altogether, which means if you were to continue to switch from Medicare Advantage to the path of original Medicare and cannot get a supplement, you are subject once again to all of the out-of-pocket costs inherent in Part A and Part B by itself, with no out-of-pocket spending limit. This is why we say people wind up getting stuck on the path of Medicare Advantage. Now let's talk about the states of New York, Connecticut, Massachusetts, and Maine. In those 4 states, essentially, the earthquake never happens. This means at age 65, when you're relatively healthier, you can head on the path of Medicare Advantage. Then, heaven forbid, you're diagnosed with cancer or Parkinson's 2 years later. You know you're going to need more healthcare services. So you go ahead and make the switch to the path of original Medicare, and you can still get a Medigap policy, no questions asked. Here are 2 things to keep in mind, though. You can still only disenroll from a Medicare Advantage plan at certain times of the year. And in those 4 states, Medicare supplement plans, Medigap plans, can be about 10% to about 200% higher in premiums than the rest of the country. Now let's get to know the steps involved in the Medicare enrollment process. There are 6 of them. Step 1 is check your timing. What we mean by this is now at age 65 the best time for you to enroll in Medicare, or should you be delaying Medicare enrollment? Heaven forbid you delay when you should enroll or you enroll when you should delay. Both can end up in very permanent, costly Medicare mistakes. The 3 most common Medicare enrollment periods that you're going to potentially face include the 7-month initial enrollment period. Again, this is the 7 months surrounding your birth month. There's also the special enrollment period. The special enrollment period is exactly that, a special period of Medicare enrollment for those who initially put off Medicare, most commonly because they were still working or had coverage through a spouse who was still working. You must qualify for this period. And of course, the general enrollment period, which happens each year between January 1st and March 31st. This can be for people who miss their initial enrollment period and do not qualify for a special enrollment period. Be sure to note, if you enroll in Medicare during the general enrollment period, your Medicare coverage will not take effect until July 1st. Now let's meet Carol. Carol's our case study for checking your timing. Carol did a lot of research when she was about to turn Medicare age at 65. Through that research, she became very fearful of late enrollment penalties. So as a result, when she turned 65, Carol went ahead and enrolled in Medicare Part A, Part B, and Part D. But she also kept her husband's large employer group health plan, which essentially meant then that she enrolled in duplicative Medicare coverage she could never use, Part B and D, which meant then that she wound up overspending on Medicare Part B and D coverage over the next 20 months to the tune of $5,200. That was essentially money flushed down the toilet. And now, potentially even scarier, she no longer has her guaranteed issue right to get a Medicare supplement plan. For Carol, this was a really big deal. She has some pre-existing medical conditions. She may never be able to get a Medicare supplement plan again in her life. So, always start with step 1, check your timing. Once you know that the timing is right and you need to enroll in Medicare, you move to step 2, choosing your Medicare path. And by path, we mean type of coverage. Is it original Medicare with a supplement? Maybe it's a Medicare Advantage plan, or maybe you have some sort of retiree coverage or military coverage options. Again, the important thing here to know is that there is no ideal Medicare choice. There is only what is best for your unique needs. So it's really important that you take the time to look at all of the options you have and choose what is best for you. Not your spouse, not your best friend, not an insurance agent. What's best for you. Gary unfortunately did not do this. Gary saw a commercial for a Medicare Advantage plan when he was about to turn 65. You've probably seen something similar. $0 in monthly premiums, free dental coverage, sign up today. Gary thought it sounded pretty good, and it does. But that is all that Gary learned about how this type of coverage works. Gary has a few chronic conditions, is hospitalized on average about 2 to 3 times a year, sees specialists, has outpatient procedures. With his healthcare needs, Gary is now stuck, potentially for life, in a type of coverage that costs him on average about $4,000 more per year than what he could have wound up paying in a different type of coverage. And he also deals with prior authorization requirements, network restrictions. He's not a happy camper. All right, so step 1, timing. Step 2, type. Then you can go ahead and select your specific plans. Selecting specific plans. This is the step where you choose United Healthcare versus Humana versus Aetna versus Blue Cross Blue Shield Part D drug plans, Medicare Advantage plans, supplement plans. Because of the amount of marketing material people get when they are about to turn 65, they mistakenly think Medicare enrollment is all about choosing a United Healthcare plan or a Blue Cross Blue Shield plan. But this is step 3. And truly, you do not want to hurry this step. Wait until step 3. All right, so timing, type, then specific plans. Once you know all 3, you can start the enrollment process into Medicare. So step 4 is where you enroll in Parts A and B of Medicare. You do this through your local Social Security office or online at socialsecurity.gov. Once you are on the Medicare rosters, then you can officially sign up in step 5 for those specific plans that you chose in step 3, those extra Part D drug plans, supplements, or Medicare Advantage plans. Finally, last but definitely not least, step 6 is reviewing your Medicare coverage annually. Each year, Medicare Advantage plans and Part D drug plans essentially change how they work. They change premiums, deductibles, provider networks, drug formularies, pharmacy networks. If you are not watching how your coverage will change, essentially you've put Medicare on autopilot, you will be stuck paying the difference. That difference can be hundreds of dollars, thousands of dollars, even tens of thousands of dollars. Dorella is our case study for this. Dorella believed that those insurance companies are going to get you no matter what you do. So what was the point of potentially making a switch into something that could be even worse? She thought it was best to just stick with what she had. She was shocked to learn that changing drug plans for just 1 calendar year could save her more than $3,000. So those are the 6 steps of Medicare enrollment. Most tools and resources that are out there today to help people are truly designed to help with somewhere between steps 3 and 6 of the Medicare enrollment process. Medicare.gov, for example, has a plan finder tool. You go there, enter your zip code, and you can compare specific Part D drug plans or Medicare Advantage plans available in that zip code. But again, you'll notice that's a step 3 tool, helping you to select very specific plans. But what is out there helping with steps 1 and 2, timing and type of Medicare enrollment? Really, when it comes right down to it, it's self-study. That's scary, because it's in these 2 steps where about 90% of the very permanent and costly Medicare mistakes are made. And as you've seen, just one mistake can literally cost you thousands of dollars a year for the rest of your life. Often cannot be undone. But luckily, you're here. So congratulations. You've already taken the first step towards getting the information you need to avoid costly mistakes. But now that you have a basic understanding of Medicare and the steps to Medicare enrollment, I'm going to introduce you to a unique way to ensure that you're making step 1, timing, and step 2, type decisions that are best for your unique needs. Introducing the I-65 Medicare Enrollment Guidance Software. This software ensures that you get the expert information you need to make the right Medicare enrollment decisions. I-65 is an independent educational company that is not affiliated with the sale of insurance products. It gets to know your unique needs and makes recommendations based upon you. By answering some simple questions you will know the answer to, you'll then receive your customized Medicare RoadMap report. This is an individualized report that details the information you need to smoothly enroll in Medicare, literally step-by-step Medicare enrollment instructions. Your roadmap also provides you with your specific initial enrollment period. In addition to the step-by-step instructions for today, your roadmap serves as a lifetime document. Print it, file it, and refer to it whenever you have questions about your Medicare situation. So now that you have a basic understanding of Medicare and the steps to enrollment, let's show you what the process of creating your own Medicare roadmap looks like. The first thing we will do to create your roadmap is to input some basic information: your name, state of residence, and your birth date. Please note, your information will not be shared or sold through the I-65 system, so take a deep breath, you're all good. Once we've entered that information, we'll work together to determine which basic category of I-65 best describes your situation. For this demonstration today, we're going to be assuming that you are going to be turning 65 years of age and plan to continue working after you turn 65, which is option 2. With this option, I'll be able to show you both Medicare timing, step 1, and type, step 2 questions. But if this is not your personal situation, don't fear. I-65 has several more options that can help about 80% of all Medicare eligible people. For those of you with very unique situations, we have other capabilities to ensure that you get the guidance you need. So with that, let's move forward. Once we've chosen our appropriate option, I-65 begins asking you some questions to better understand your unique situation. These questions do not require you to understand Medicare regulations. You simply need to know relatively basic things about you. For example, the first question is, are you receiving Social Security benefits? If you don't happen to understand any of the questions while going through the process, just click the More Information buttons. You'll find a lot of valuable information by clicking these buttons that will help you understand the questions or any unknown terms. For our demonstration, we'll say no because this person plans to continue working after 65. For this demonstration, we're going to skip a few questions here and there, but we'll definitely hit the highlights. Now, this question. Does the company sponsoring your group health plan have 20 or more employees? We'll say that our company has 20 or more employees. Option A. I-65 has some important information to convey at this point. So let's read what's in that valuable blue box. You are able to keep your current health insurance sponsored by a company with 20 or more employees after you turn 65. But then the question becomes, should you? Because you also have the opportunity to drop this coverage and fully enroll in Medicare. So which option is best? I-65 has a tool to help you create an apples-to-apples comparison of your current health insurance against Medicare. Let's take a look at that tool. This tool, again, will help you take into account many factors that you might otherwise overlook in order to truly create an apples-to-apples comparison of your employer group health plan against Medicare. These factors are things like, does your plan include dental or vision coverage, which Medicare typically does not include? Or are you subject to higher Medicare premiums? That's definitely a factor to keep in mind when making this comparison. Do you have any dependents on your employer plan? If so, they'd have to get other coverage if you move to Medicare. Do you contribute to a health savings account? If so, you'd have to stop making contributions if you move to Medicare. This could be considered a cost against original Medicare. All of these factors are then added together to really help you create that true cost comparison, which makes determining which option, your employer group health plan or Medicare, is the best option for you. So let's say that we've completed that tool and we've determined that it's better to fully move to Medicare. On the next question, which says, will you continue with your current plan once you turn 65? Let's say no. If we had decided to continue with the current employer coverage, we'd still have to answer a few more questions before we'd get a roadmap. So now we have some more important information to read. Basically, Medicare will be your only coverage once you turn 65. Now you have to enroll in Medicare Parts A and B and pick a Medicare path, which will either be original Medicare with a Medigap or a Medicare Advantage plan. This is a very important decision, so consider your options carefully. Because you are enrolling in Medicare Part B, you do have a guaranteed issue right to get the coverage you want without any medical questions at this time. However, in the future, depending on where you live, your ability to change types of Medicare coverage may be limited, and we'll talk about this more as we go on. Next question. Do you typically spend considerable time at another location in the U.S., or do you plan to do that soon? If we were to click the More Information button, we'd learn that this question is referring to domestic travel for extended periods of time. Let's say yes to this question. Now, which of the following best describes your health? A, I have one or more medical conditions requiring regular medical care and monitoring and could be considered progressive. B, I have one or more medical conditions managed by medication, treatment, diet, or lifestyle. Or C, I do not have any medical conditions or significant medical history. Let's go with middle of the road today and choose B. When it comes to managing your finances, which option do you prefer? A, predictable monthly premiums with little or no out-of-pocket expenses for medical care. Or B, considerably reduced monthly premiums, but with the risk for greater and maybe unpredictable out-of-pocket expenses. For this example, I'm going to go with a more budgeted approach to Medicare expenses, or A. So now the system is ready to start making some Medicare recommendations to us. So it's asking us if we're good with how we've answered our questions. If we wanted to make some changes, we could do so by clicking on any of the gray Change Answer buttons located on the right. But I'm going to say our answers are good, click the I Understand button and lock down our questions. Now, I-65 is making some recommendations on the type of Medicare coverage it thinks would be the best for this person's unique needs. But more importantly, it teaches you why. So, the answers to I-65 suggest original with a Medigap policy as the best option for you. Why? You plan to spend time in other locations. Your medical condition is under control now, but if your health were to change or you'd need medical attention while traveling, you'd be able to see any physician who accepts Medicare, no matter where you may be in the United States. Original Medicare does not use networks. Plus, coverage of foreign travel emergencies is an optional Medigap benefit. Both a Medigap policy and drug plan have monthly premiums, which you prefer. With this coverage, you'd face little or no out-of-pocket expenses for medical care and generally predictable medication costs. Remember, during the first 6 months of Part B enrollment, you do have a guaranteed issue right, meaning your medical history will not affect your ability to get a Medigap policy. All right, so we'll go ahead and say we understand this information. Now, it's important to know that I-65 again makes recommendations, but it does not make decisions. It's your life, your health, your money, your Medicare, so it's your choice. The system will ask you what you would like to do. The first time you see a question that begins, "Will you choose?" however, I highly recommend that you go against that initial recommendation to learn more about what your other Medicare option might be. In this case, that's Medicare Advantage. So we'll pick B. This will teach us more about how Medicare Advantage might work for this situation. Here's a summary of what this tells us. First, Medicare Advantage plans do have lower premiums than original with a Medigap policy, sometimes even $0 in monthly premiums. However, whenever you use healthcare services, you'll pay deductibles, copays, and coinsurances up to that plan's out-of-pocket spending limit. Also, Advantage plans use networks, so if you need medical care away from home and the physicians are out of network, you may have no coverage. If you choose to get a Medicare Advantage plan, consider getting a PPO plan. This type of plan can provide some out-of-network coverage and allows you to choose your doctors without a referral. But your costs out of network will be more than in network, and you may find that a PPO is not available at all in your area. Also know you may face prior authorization requirements with an Advantage plan, so before you can use certain services, you'll have to get the permission of the insurance company. Finally, there are notes about your 12-month Medicare Advantage trial period. which allows you to switch back to original Medicare anytime during that period and still be able to get a Medigap policy with no questions asked. But after that trial period, 12 months, 1 day, you may not be able to get a Medigap policy. Okay, with that summary, we'll click the I understand button. Once again, you're in the driver's seat. So now the question is, will you choose a Medicare Advantage plan? Let's say for this demonstration that we prefer original Medicare with a Medigap plan. So we'll click B. Now we're going to generate our custom Medicare roadmap. Your Medicare roadmap is essentially like 2 documents in one. The first part of the document is very specific information to assist you enrolling in or delaying Medicare, depending on your situation. The rest of the document is more, again, of a lifetime document. Print it, file it, and refer to it if you ever have questions about your unique Medicare situation. It's like your own personal Medicare user manual. On this page, you'll notice your name, the date the report was created, and your unique Medicare destination. In this case, Medicare Parts A and B with a Medigap policy and a Part D drug plan. Page 2 in every report is handy Medicare-related resources. You'll find important links for Medicare websites in addition to contact information for an independent local insurance agent you may want to consider to help you get specific Medicare plans. Since this report is for a person turning 65 and enrolling in Medicare, it includes this person's specific initial enrollment period, based upon the birth date provided at the beginning of the process. This illustration again shows you when you can take action to enroll in Medicare. Then, based upon when you take action, it shows you when Medicare coverage will actually begin. Now, the all-important step-by-step instructions you need to take related to Medicare enrollment. Again, these are going to be specific to your unique situation. In this case, this person will need to take action to enroll in Medicare Parts A and B. They could get started in doing this by clicking this link, and then the roadmap includes how to answer specific questions that you will encounter during the steps of the Medicare enrollment process. Then you'll notify the plan administrator at your employer about your decision to discontinue coverage. Next, you'll enroll in a specific Part D drug plan. Your roadmap directs you back to the resources listed on page 2 of this report to help you through this process. Similarly, you'll also need to select and enroll in a Medigap policy, again, directing you back to page 2. Finally, don't put Medicare on autopilot. This roadmap instructs you to pay attention to your drug costs and coverage throughout the year so that you can participate in open enrollment. The remainder of your Medicare roadmap is that lifetime document. Print it, file it, and refer to it whenever you have questions about Medicare. This section reminds you what factors played important roles in choosing your type of Medicare coverage. If you choose to work with a Medicare insurance agent, this section can come in very handy to help you explain to an agent why you chose the type of coverage you did during the I-65 process. Your roadmap also contains information to help you select specific plans and then understand that coverage if you ever have questions about it. For example, this section explains how Part D drug plans work. It teaches you about the 4 payment stages of drug coverage in every Part D drug plan, including that notorious donut hole. Similarly, it will give you information to help you choose specific Medigap policies and then provide you with important information that you may need as you live with this type of coverage. And of course, a page on open enrollment, describing what open enrollment is, when it is, why it's important, living with original Medicare. This is one of my favorite sections because it has a lot of important tidbits about everything from how to find new doctors to dispelling myths about Medicare and long-term care. For example, many people believe that Medicare will cover long-term care, but it does not. Your roadmap will give you more details. Your roadmap is also going to dig into other goodies like foreign travel or what if you ever decide to move. Your roadmap provides guidance on how to pay your monthly Medicare premiums and how to set up an Easy Pay account. If you're potentially going to be subject to higher Medicare premiums based upon your income, your roadmap will teach you about IRMA, which stands for the Income-Related Monthly Adjustment Amount. And that's basically a summary of some of the contents of a Medicare roadmap. That takes us to the end of today's Medicare Basics presentation. But very, very important, if you'd like to create your own custom Medicare roadmap, please set an appointment with us before you leave today. We'll get you hooked up with the software and potentially even guide you through the software if you'd like us to. And of course, if you liked this session today, please tell your friends. Thank you so much.